This Teach One assignment is for process improvement through EHR on genetic information used for management of depressed patients by Mary Allison Evers. The objective of this assignment is to identify the information needed for proper input into the EHR during all steps of the diagnosis. Information needed during first call to clinic, information needed during first visit to clinic, recommendations by the doctor, information needed during follow-up visit, referral to psychiatrist, and all of the necessary information then given to the psychiatrist's office to input in their EHR. The information needed on the first call to the clinic includes patient name, patient date of birth, insurance information, and the reason for the visit. The information needed during the first visit includes patient demographics, patient allergies, patient history, patient height and weight, patient's blood pressure, the patient's reason for visit, signs and symptoms, and the patient's lab results. The recommendations from the doctor during the first visit include: the doctor recommends that the patient try to stay positive and stay away from intense, stressful situations. The doctor reviews all the necessary information, the symptoms, the history, lab work, and thinks the patient would benefit from an antidepressant medication. The doctor then prescribes the patient an antidepressant medication and asks that the patient follow up in 8 weeks. The doctor suggests that if symptoms worsen or there are any thoughts of suicide, that the patient seek medical attention immediately. The information needed for the follow-up appointment includes new insurance information if any changes were made, the patient's new weight, the patient's new blood pressure, the patient's new symptoms if they got better, worse, or stayed the same. The recommendations from the doctor during the follow-up appointment include: the patient's symptoms have gotten worse, they are now even more depressed. The doctor thinks it may be a side effect from the medication. The doctor then recommends that the patient see a specialist. The doctor referred the patient to a psychiatrist and had an appointment made for the next day. The information needed from the patient on the first visit to the psychiatrist includes the referral, patient demographics, patient allergies, patient history, patient height and weight, patient blood pressure, patient's reason for visit, sign and symptoms, and the lab results. The recommendations from the psychiatrist include: the psychiatrist performs a genetic test to understand the patient's depression. After getting back the test results, the psychiatrist is able to get to the root of the problem. The psychiatrist is now able to understand the problem and know which medication is right for the patient. The psychiatrist prescribes the patient a new antidepressant and recommends that the patient come back in 8 weeks. The psychiatrist tells the patient that if the symptoms get worse or if there are any thoughts of suicide, to seek medical attention immediately. The information needed during the follow-up appointment with the psychiatrist includes new insurance information if any changes were made, patient new weight, patient new blood pressure, patient symptoms if they got better, worse, or stayed the same. The psychiatrist's follow-up recommendations: the patient's symptoms are better and they are beginning to feel like themselves again. The psychiatrist recommends that the patient stay on that medication and call to make an appointment if the symptoms reoccur. The optimal business process includes: during the first call, order labs so the results are available during the first visit to reduce an additional visit to the clinician. Review lab results and symptoms carefully to determine if the patient needs an antidepressant medication. Once it is known that the patient needs a medication, prescribe what is best for the patient. Have the patient follow up in 8 weeks. When finding out symptoms are worse or not getting any better, refer the patient to a psychiatrist. When referring to the psychiatrist, recommend to the psychiatrist to have a genetic test done during the first visit to reduce additional visits. All of the above are great suggested steps to reduce the number of visits to the clinician. This is a chart that has a list of decision and information items needed during each visit.